Hello, everybody. My name is Debbie. I'm a clinical nurse specialist in urological cancers from Cornwall. Today, we're joined by Pete, who has very kindly offered to share his experiences of being on active surveillance. So to start, I'm going to ask him to introduce himself. Pete, I was wondering if you could just give us your name, your first name, age, and tell us a little bit about when you were diagnosed and how you came to be on active surveillance.
Yeah. Hello, my name's Peter. I'm 61 years young. I was diagnosed when I was 59 in November 2022. So I had inflated PSA test, although my PSA was not high, it was 2.62. But over previous ones, it had gone up by 20%, which I gathered as a trigger for more inquiries and investigation, if you like. So I had an MRI that led to the identification of a lesion, which at that point was 8.5 millimeters. From that was a biopsy, which was a precision point biopsy. 24 cores were taken, and from those 24 cores, there was cancer found in one of those cores. So, and the Gleason score was 3 + 3, 6. As a result of that, the multidisciplinary team, I believe, felt that active surveillance might be the preferred option for me. I then had an appointment with a consultant and specialist nurse at the hospital, and the treatment options were discussed, definitely. So the options I was given was radiotherapy, brachytherapy, active surveillance, or surgery, in fact, removal of the prostate. That's what the options I was given at that time. I didn't make a decision right away, to be honest. I think I kind of like had an idea which way I was going to go, but me being me, I like to research a bit more and find out a bit more, and that's what I would advise everyone to do your own research on these things. So I went away, read the booklets that I was given at the hospital, did some other research as well, and then speaking with my wife, felt that active surveillance was the best course of action. And the main reason for that was something that the consultant said was that most men will die with prostate cancer as opposed to of prostate cancer. I did go and get a second opinion, I'll be honest. I did go and see a consultant privately as well, and his advice was exactly the same. Yeah, active surveillance, best course of action, because any of these treatments are so the consequences, side effects can be quite drastic. Leave it as long as you possibly can.
Absolutely. You did the right thing. I think it's really important to go away and do some of your own reading, because it's a massive decision to make. And like the consultant you saw said, treatments are not without side effects. So having that in your, having read about it, you're then making an informed choice. So absolutely, I would encourage anyone to do that.
Yeah.
So what were your first thoughts, just thinking back when you were first told active surveillance, when you know that you've just been told you've got cancer and then they're saying, but we're not going to do anything about it. How did that make you feel?
Yeah, it's the shock is the first thing. It's like no one wants to hear that, do they? The big C, that word. That was quite a shock. And then when it was spoken about active surveillance, it kind of like, and to some extent, even now, I still feel a bit of a fraud. It's strange, really. It's like, have I got it or haven't I got it? What's going on here? You know? And I follow lots of groups.
Absolutely.
Well, I follow a couple of groups on Facebook which have been really, really useful in terms of information. And again, when you read some people's stories or journey, whatever we want to call them, you think, oh my goodness me, crikey. No, have I got a
Yeah.
right to be on this group? That's sometimes hard because so far I've got off light, really.
Yeah. And people tell you, you look well. Those that you've chosen to tell that you've
Yeah.
had that diagnosis. They will very often comment on how well you're looking, won't they?
I get it all the time.
So when you decided on active surveillance, what what questions would you have asked of the healthcare team, and did it at all? What information about active surveillance did the nurse or the doctor give you to explain
Yeah.
it?
So what I was told initially was that I would have 3 monthly blood tests, PSA tests, and that I would be monitored for that. At 12 months, I'd be given another MRI. This is what I was told. And then from that, they would decide whether another biopsy would be required or not. So the PSA test and looking at what they're seeing on an MRI, from that they would decide whether another biopsy would be required. And that's what I was told. And I was kind of like quite happy with that initially, but over a period of time, they lost me. I can't put it any other way. I was under surveillance, but they lost me. And it was it sounds strange because you think it'd be on your mind all the time, but it wasn't. It was only after about 6 months into it that I thought, I've not had anything from the hospital. I've not had a PSA test for a while now. How long ago was it? And then I started looking back, and time flies, doesn't it? We're all busy people. And you think, gosh, it was 6 months, 6, 7 months. And it's then I contacted the hospital and said, look, I've not had anything from you. And that's when my doubt over active surveillance started, to be quite honest. Well, that's not very good. Now I say that knowing other people have fantastic experiences. I do say that, I point out, but my experience was that, and that's when I really started researching more and more into prostate cancer and treatments. And that's, of course, when I found out there are other treatments, especially if you've got low grade prostate cancer and it's contained, focal therapy treatments. But it's you're not told that. If your hospital doesn't offer focal therapy treatments, well, certainly I wasn't told that. And my understanding is most men are not told that either. And men have a lot of treatment that probably isn't necessary. There's only a few health authorities that do focal therapy treatment. That's my understanding, definitely, from what I found out myself.
Yeah, I think the thing with the focal therapy and the evidence isn't as high. So that's why a lot of places don't discuss it, especially if they haven't got anywhere nearby. So those places that do quite often are either private or looking at trials or things like that. So that's why it's very often not spoken about. But I'm sure the day will come when it is spoken about more widely. I think just going back to your mentioning that you got lost in the system for 6 months, that's quite scary. And I'm sure anybody that's listening who's been told they're going to get 3 monthly monitoring and then have a scan if things are changing. I always say to my patients that are going on to active surveillance, but for them, they're the only person. For the people that are reviewing things, they may have thousands. And all it takes is for somebody to inadvertently forget to tick a box on an appointment system because the phone has rung or somebody's walked into the office and asked them a question. So unfortunately, to err is human. And whilst layers are built in to try to stop people slipping through the net, it can happen. And I always say to my patients, they've only got themselves to worry about. So I say, make a point of scheduling in your diary or on your calendar on your phone to make sure that if you haven't heard, a week beyond that 3 months is to get in touch with the specialists that are perhaps considering it, just in case, you never know, somebody might have got run over by a bus and nobody's picked up the slack, kind of thing. So and so do you are you more proactive now about the monitoring?
Yeah, definitely. And I think you again, my giveaway is like you have to take control yourself. You really do. You have to find out as much as you can, and certainly when it comes to your periods of testing, do that.
Absolutely.
So I actually then I wasn't happy, and I did have another MRI. I'm trying to think. I've got a date on this. Something. I had not an MRI. Yeah, I had another MRI in June 24, and from that, the result was the biopsy. Sorry, the lesion had increased in size a little bit.
Yeah.
So then the discussion with the hospital was whether to have another biopsy or not at that point.
Oh, joy.
Yeah,
Did you look forward to that?
Well, I'll be honest, again, it was the specialist nurse I was speaking with, not the consultant. I've not seen the consultant since my first diagnosis. That was the other thing. So it's the specialist nurse I was speaking with, and the message I was being told was that you could have a biopsy if you want, but we're happy to keep you on active surveillance. So it's kind of like I took that to be there's mixed messages here. For me, there's mixed messages. I'm not that sort of person. You need to tell me what I need, and I will do it. So tell me to jump through a hoop, I will jump through a hoop. That's where patient individuality comes into it. I think that might work for some people, but it certainly doesn't work for me. So in the end, it was at that point, having been lost in the system and the unclear messages, I went further afield and I moved hospitals to a hospital that does offer focal therapy treatment. And the service I've received from them has been amazingly different to what I feel I've been having up until that point, to be honest. So, and then I did have another biopsy. They did say you should have a biopsy, basically. So I did have a second biopsy. And on that one was more, their equipment apparently is more refined. They took less samples. The result of that was they didn't find any cancer in the samples they took. So,
right.
Yeah, they only took 12, but they were taken from the lesion, mostly from the lesion, and a few around the outside.
Yeah.
So in one way, that reinforced what the first hospital said: you are low risk.
Absolutely.
Yeah, so it was pleasing to know. Yeah, biopsies are an experience, I have to say.
Yeah. And I think that's one of the reasons why they say if they know that they've got some tissue that shows that there is cancer, it is quite often suggested to you if the lesion is growing, if the PSA is consistently rising, if you know there's cancer there, then offering treatment without doing a repeat biopsy, if somebody's really, really not keen on the biopsies, is acceptable. But like you say there, Peter, unfortunately, repeat biopsies quite often don't show the cancer because if it's only a very small amount, a few millimeters, the needle might go either side of it and not pick it up. But you can take reassurance from that, because if you had a great big lump of cancer in there, the needles would have hit it, especially with the targeted like the fusion biopsies that can be done now. Can I just ask about sort of the psychological impact of between having your PSA done and getting those results? Did you find that you started to get phantom symptoms or increased anxiety?
Symptoms, no, definitely not. You can't, a little bit anxious when you know that the 3 month or 6 month when your next PSA test is due. Do things like I stop exercising and things like that, because again, there's an argument. Some people think vigorous exercise inflates your PSA level. Others say definitely not. Only intercourse ejaculation does. I don't know. So yeah, I certainly refrain from things which might spike it somewhat before. So I guess it's on my mind. Yeah, definitely. Yeah.
Absolutely. Yeah. And that's the thing. I think riding a bike is one of the culprits.
Is it? Okay.
So I think it's that massaging of the prostate through the saddle can make the PSA go up. But absolutely, you're right. And intercourse can, as well as infections and instrumentation of the bladder or the prostate, the bladder or the bowel, sometimes that can affect it as well. So there's lots of reasons for it to go up and down. And I think so sometimes you might see a spike in the PSA and then they'll suggest, oh, let's just repeat it in 4 or 6 weeks to see if that's a genuine spike, and then it's settled down again. So we do see that. And when you explain to your friends that you've opted not to have treatment and you've got cancer, do they sort of try and persuade you that you should be having surgery, catch it early, you should have treatment?
No, I've not had that at all. I
No.
think mainly because people are less informed than what I am really. Certainly, men don't talk, do they? Guys don't really talk.
No,
We all
that's
know that.
true. Us
Um,
women, we sit and have coffee, and we know the ins and outs of everything by the time we leave. Whereas
yeah,
it's
absolutely.
not uncommon for chaps to talk about Formula One or football, I guess.
No, you just start talking about your prostate and what your biopsy, and they're out the door.
Yeah, absolutely. Well, yes, especially the biopsy flip.
Hmm.
But it's I think having the conversation and being open about it. You read about the number of people whose friends or neighbors or family were diagnosed because you had had a test and they went and had one just in case, and that's how they get their diagnosis. So I think having the conversation is absolutely to be encouraged. Hopefully, like you said, you'll be on active surveillance and not needing treatment for a very, very long time. And in the past, we have had situations where we've had people that have been on active surveillance. And when we say, actually, it's time we pulled the trigger and you considered having treatment, and the men are quite happy, thank you very much, and they'll try and negotiate not having treatment still. So
Yeah.
have you sort of have you sort of stretched the boundaries at all?
Only in so much as that's why I approached the other hospital was whether I was suitable for focal therapy treatment, and they've
Yeah.
said yes, I am, but they wouldn't. They don't even think I need that at the moment.
Oh,
So,
so
so,
still on
so long as
3 monthly,
sorry, say that again.
still on 3 monthly PSA?
It's 3 monthly, although they might reduce that to 6 monthly now.
Yeah. Hooray. You can get planning your holidays.
Yeah, I don't mind 3 monthly ones. That's okay. I'd rather that, but I'll go with what they say.
Yeah, excellent. And so did you access any other support systems? Did you feel at all that the information that you'd been given was enough? Did you like seek the additional information from your clinical nurse specialist, or any referrals to other support strategies such as counselling or relaxation or anything like that?
No. In short, no. Social media, really. Lots of information. From that, I then contacted someone it's an organization called Prost8, and I contacted the founder of Prost8
Yeah,
and spoke with them, and it was through him that I got the referral to the hospital in London, to be honest,
yeah,
and I'm glad I did.
yeah.
Um, so just that, yeah, really. I'm just researching online myself.
And
Usually,
there's
you get the
go on.
stuff that pops up on Facebook, and whilst I would say don't click on any link, you could Google it yourself, and
Indeed. And
you bring up the reports.
in the first instance, did you use, I mean, you're probably aware there's the InfoPool, Prostate Cancer Research do the InfoPool, which has got quite a lot of helpful information,
Yeah.
and tried and tested. So it doesn't lead you down a rabbit hole of drink this potion that comes from Western Australia, or start taking CBD oil or anything like that. And just on that note, actually, were you ever advised about like diet and exercise and things that you could do to help yourself to reduce
Just
the risk of the cancer advancing?
just on initial diagnosis, you come away with booklets. Well, and certainly diet is one of those foods to eat and stuff. But I eat quite healthily anyway. I'm aware of processed foods and stuff. Do a lot of own cooking. At the time of diagnosis, I wasn't. I used years ago. I was a real gym person, 5 days a week. But over the years, I stopped doing that. However, for the last year, I go to the gym 3 times a week now as well. Keep fairly fit, yeah, yeah. But in
Excellent.
terms of therapy or anything like that, no, no. I'll be honest. I've in the past, nothing to do with this. I've spoken to therapists before. It doesn't really work for me. It works for some people, but it doesn't work. I'm a fixer. My occupations always have been like, see a problem, I'm going to fix that. I'm going to solve that. That's my, you know. So talking about it doesn't work for me. I want solutions.
Absolutely. Like you say, it's not one size fits all. It's very much
No.
individualized. And something else that you said there about being a fixer, excellent, you know, and there is such a wealth of information and support out there that people can tap into. But your cancer nurse specialist is quite often somebody who can point you in the right direction. Have you found that that's a useful relationship?
Um, well, the one I had previously at my local hospital, not really, sadly, not really, no. But then I didn't ask for help. I just took, you know, active surveillance. Okay, I assumed I would be monitored. And then when I realized I wasn't being as monitored as closely as they promised,
Yeah,
that's
took
when I
yourself
thought,
off. I don't
okay.
blame you.
And
Yeah,
then I just, you know, they're busy. I know everyone's busy. But then I found out there were other treatment options, albeit not
yeah,
recommended by NICE. But that seemed to be better for me, if that
yeah.
makes sense.
And I think that helps you to manage your you know that if you needed it, the option is there. And it's you've got somebody else keeping an eye on you. So that's
Yeah.
absolutely. So just one last thing. If there is anything you wanted to say about active surveillance or tips that you would give someone else who's considering active surveillance, what would it be?
It would be you have to manage yourself and from my experience, manage other people as well. Don't just assume things are going to happen. So push if you're not being given your appointments for PSA tests, it might be, you know, you've got to be on top of that. Take control yourself, really. It's down to you. You'll get a lot of support, but it's down to you. Help, you know, and NHS in particular needs help, and you know that.
And like you said, it's it's you. And it's very personal, and just being aware of what's happening. It's very easy to forget. You're getting out, you're getting on with life, you're carrying on with work, you're going on holidays, you're seeing family, and before you know it, 3 months or even 6 months has gone by and you've forgotten. And if somebody else has, if the people that are supposed to be organizing those tests have forgotten, then but so having a reminder somewhere in your calendar is really helpful, because before you
Yeah,
know it, the potential for missing a test is quite high.
that's it. Yeah, yeah, definitely. So just that, and learn as much as you can yourself. Really.
Absolutely, because if you're informed, you can properly make a good choice.
Mhm. Yeah.
Thank you very much. That's brilliant. And I'm so glad that we had the opportunity of sharing this experience today.
Okay. Thank you very much. All the best.